So during this GI ASCO 2022, we were able to present our findings from a phase 2 study of FTD TPI in combination with Ramucirumab in refractory gastric and GE junction adenocarcinomas. This is a single institution, single arm phase 2 study combining FTD TPI, also known as TAS-102, in combination with Ramucirumab. Based on the Rainbow and the Regard study, Ramucirumab alone or Ramucirumab in combination with paclitaxel has been FDA approved for second-line treatment of gastroesophageal cancers. One of the major drawbacks of using the combination of Ramucirumab with paclitaxel has been the increased rate of neuropathy that is resultant as a result of treatment. The expected rate of neuropathy could be anywhere up to 46%. Therefore, it's always been an impetus for researchers in this area to find newer combinations that could potentially be effective for our patients, but at the same time, provide them a better quality of life and reduce the rates of neuropathy with treatments. So in this study, we combined TAS-102 or FTD-TPI at its FDA-approved dose of 35 milligram per meter square orally twice daily, days 1 through 5, and then 8 to 12. And Ramucirumab was 8 milligram per kilogram given intravenously on days 1 and 15. Our primary endpoint was 6 months overall survival, and secondary endpoints were progression-free survival, overall response rate, and safety profile. Interestingly, there was also an Asian study that was published in 2021 with a similar combination. And we can kind of say that a similar disease control rate was seen even in our study. In this study, we enrolled 23 patients. The median age was about 62 years. Majority of our patients were GE junction cancers, so 19 were GE junction cancers and only 4 were gastric cancers. The 6-month overall survival rate was 56.2%, with a median overall survival being 6.2 months. The median progression-free survival was 4.9 months. We saw one partial response that amounts to about 6%, and rest were stable, and majority had stable disease of about 88%. There were some toxicities that were associated with this combination. About 48% patients experienced grade 3 and grade 4 treatment emergent adverse events. And most common of these were neutropenia in about 17% and anemia in 13%. What we noticed as our experience with this combination is that although there is some disease control rate, it does come with significant toxicities, most likely related to the FTD TPI, due to which a lot of patients had to come off trial. However, this is a promising combination that can be tested in further larger scale phase 3 trials and compared to the current standard of Ramucirumab paclitaxel. It will also be interesting to see how this combination pans out now that our first-line treatment paradigm has changed, with majority of our patients receiving chemotherapy plus immunotherapy, and to see how VEGF inhibition can be optimized for these patients for better efficacy.